Hello, my dear student. In this chapter, I want to talk about the respiratory system anatomy. The respiratory system can provide the means for gas exchange, which is necessary for our living cell. As cells engage in aerobic cellular respiration, they need both the uninterrupted supply of oxygen and the removal of carbon dioxide waste that is produced. This continuous exchange of oxygen and carbon dioxide between the atmosphere and the body cells occur through collective process which we call it respiration. And this is the responsibility of our respiratory system to do this exchange. In this part, I want to talk about the respiratory system anatomy, and after that, I will talk about the physiology of respiration for you. The respiration is gas exchange. We can exchange oxygen for carbon dioxide, and it occurs between atmosphere and our body cells. Our cells need oxygen for aerobic ATP production, and they need to dispose their carbon dioxide. The respiratory system can provide the means of gas exchange. In the respiratory system, we have respiratory passageway in head, neck, trunk, and lungs. And I want to talk about them and introduce these different organs to you. In this slide, you can see the general function of our respiratory system. First, it can pass the air for us. So the air passageway is the first function. The respiratory tract is a passageway for air between the external environment and the alveoli or air sacs which we have inside the lung. The air is moved from the atmosphere to alveoli as we breathe in and then expelled to the atmosphere as we breathe out. The respiratory system is the site of exchange for oxygen and carbon dioxide. A thin barrier between the alveoli and the pulmonary capillary can provide the site for exchange of oxygen and carbon dioxide. Oxygen diffuses from the alveoli into the blood, and carbon dioxide diffuses from the blood into the alveoli. The other function of the respiratory system is odor detection. Olfactory receptors, which are located in the superior region of our nasal cavity, can detect odors as air moves past them. Sensory input from these receptors is then relayed to various regions of the brain for interpretation and for detection of the specific type of odor. The other function of our respiratory system is sound production. The vocal cords of the larynx vibrate as air moves across them to produce sound. These sounds then resonate in upper respiratory structure, and then it can come out of our nose. And the rate and depth of our breathing can influence the level of oxygen, carbon dioxide, and hydrogen ion. You need to know that the level of carbon dioxide is very important for the pH of our blood. As the carbon dioxide increases, the pH of our blood comes down, and I will talk about it in the respiratory system physiology for you. And the rate and depth of breathing also can influence the venous return of blood, lymphatic return of fluid to the blood, which I talked about them in lymphatic vessels, and also the veins. We have two different divisions for our respiratory system. The first division is a structural organization. We can divide our respiratory system, look at this picture, we can divide our respiratory system to upper respiratory tract and lower respiratory tract if we divide them structurally. In the upper part of our respiratory system, we have the nasal cavity, then we have pharynx, and after that we have larynx. And the lower part of our respiratory tract starts from trachea, then we have bronchi, after that we have bronchioles, then we have alveoli and air sacs. But we have the other subdivision for our respiratory system. This subdivision is called functional division or functional organization of our respiratory system. In this functional organization, we have two different zones. One zone is called conducting zone, and this zone can only conduct the air. It starts from the nose and it continues to the bronchioles. And after that, we have a respiratory zone, the zone which can do gas exchange. And this zone contains the alveolar duct and alveoli. And also the respiratory bronchiole is located in this part, and I will talk about them completely for you later. In the respiratory system, we have a specific type of epithelium. The respiratory passageway is exposed to the external environment and is lined internally by a mucosa. The mucosa is the epithelium. And when this mucosa combined with the connective tissue which we have beneath it, we call it mucous membrane. And this mucous membrane can line our respiratory tract. We have epithelium, which is rest on the basement membrane, and beneath the epithelium, we have a connective tissue, and the name of our connective tissue is lamina propria. From now, you hear this name many times in digestive system, in respiratory system, urinary system, and reproductive system. This lamina propria is the connective tissue, the areolar connective tissue, which is located beneath the epithelium. And respiratory epithelium become thinner from our nose to the alveoli. And now I want to talk about this type of epithelium on the slides. Look at this picture. In this picture, you can see the respiratory epithelium. In this respiratory epithelium, first, the epithelium which we have in our nasal cavity, pharynx, nasopharynx, and trachea, our epithelium is pseudo-stratified ciliated columnar epithelium. And between these epithelial cells, you can see goblet cells. And the goblet cells can secrete mucus on the surface. The cilia can beat forward and backward and sweep all the dust or small particles which enter our nasal cavity. And then you can see this thin basement membrane here, and beneath the basement membrane you have areolar connective tissue, which we call it lamina propria. This is the epithelium which you have in the upper part of your respiratory system. Now, when we come down from the nasal cavity and trachea to the bronchus, bronchioles, and then the respiratory bronchioles, alveolar duct, and then the wall of the alveolus, the thickness of our epithelium become thinner and thinner. Because when the thickness of epithelium is thick, it cannot do exchange by diffusion. In diffusion, in chapter 4 in 2050, we talked about this process. We need to have a very thin membrane to let the material to do diffusion. And we need to change this pseudo-stratified ciliated columnar epithelium to a thinnest epithelium which we have. And this thinnest epithelium is the simple squamous epithelium. We have it in alveolar duct and alveoli, and then we have gas exchange very easy. Now, first I want to talk about the first one, the pseudostratified ciliated columnar epithelium line the nasal cavity, paranasal sinuses, nasopharynx, trachea, inferior part of our larynx, the main bronchi, and the lobar bronchi. Then, when we come to segmental bronchi and a smaller one, and the bronchioles, this pseudostratified change to simple ciliated columnar epithelium. And as you see in these two pictures, when you compare them, the second one is thinner than the first one. After that, we have the other change. The epithelium changed to simple ciliated cuboidal epithelium, which line terminal and respiratory bronchiole. As you see here, the epithelium again become thinner, and most of our cells lose their cilia. And when we reach the alveolar duct and alveolus, then this epithelium become very, very thin. It becomes simple squamous, and now it's thin enough to do exchange of oxygen for carbon dioxide. All of these changes happen gradually. First, we have pseudostratified. Gradually, the thickness decrease, and we have simple columnar. Then the columnar become low columnar, then it's become high cuboidal, then it's become cuboidal, low cuboidal, and after that we have a squamous epithelium. And our respiratory mucosa can secrete the mucus, and this mucus is secreted from the goblet cells which we have in this epithelium. The mucus and serous gland are presented in the lamina propria, and both of them are secreted on the surface. The mucus contain a protein which we call it mucin or SNOT, and increased mucin viscosity, and this mucus can trap dust, dirt, pollen, and everything which enter our nasal cavity. During the day, we can produce 1 to 7 tablespoons mucus. In this secretion, we have secretion of serous from the glands which we have in lamina propria. These serous contains lysozyme. Lysozyme has antibacterial activity and enzyme. We have defensin. Defensin is again antibacterial protein, and we have IgA or immunoglobulin A, which is the antibody, and this IgA is present in all of our mucous membrane. And when you cough up this mucus with saliva and trapped substances, we call it sputum. Now you can answer these questions. What is the difference between the conducting zone and the respiratory zone? How does the respiratory mucosa change along its course? And is the trachea located in the upper or lower part of our respiratory tract? And what is sputum? Now, I want to start from the upper respiratory tract, and I start with the nose. The nose is the first conducting structure for inhaled air. Look at the picture of the nose. I explained the previous slide on this picture. As you see here, the nose is formed by bone. You can see the nasal bone here. We have a pair of nasal bone. You can see a pair of septal cartilage, which one septal cartilage which we have here, and we have pair of lateral cartilage in the right and left side. We have pair of alar cartilage which are located in the right and left side. So these are the bony and cartilaginous structure which we have in our nose. And on the surface of these bones and cartilage, we have a skin, and beneath the skin, we have dense irregular connective tissue. You can see the bridge of nose, which is made by paired nasal bone here, and the cartilages which we have on both sides. The opening of our nose are called nostril or external nares, and it's made up of a dense irregular connective tissue, and you can see this opening here. But what about the nasal cavity? Here you can see the sagittal section in the midline, which we call it mid-sagittal section. And in this mid-sagittal section, you can see the structures which we have inside the nose. You can see the nostril or external nair here. Then here is the nasal cavity. I will talk about this nasal cavity and the concha which we have here later for you. And after the nasal cavity, you can see a tube-like structure which we call it pharynx. And the pharynx is divided into three parts: nasopharynx, oropharynx, and laryngopharynx or laryngopharynx. And I will talk about larynx later for you. Now, I want to talk about these slides. Here you can see the nasal cavity. The nasal cavity starts from the nostril to the guana. The guana is internal nair. So our nasal cavity starts from nostril and it ends in guana. And guana can lead our nasal cavity to the pharynx. Here you can see the floor of our nasal cavity. The floor of our nasal cavity is made up of palate. The palate can make the floor of nasal cavity and the roof of our oral cavity. And in the palate, we have two different parts. One part is bony, we call it hard palate. The hard palate is made up of maxilla and palatine bone. And after that, you can see the soft part, the membranous part, which we call it soft palate. And the end of soft palate can make uvula or uvula for us. This finger-like projection, which is suspended on the roof of our mouth cavity. Then you can see here you can see the nasal septum. The nasal septum can divide right and left side, and you need to know that your nasal septum is composed of two different bones. One of these bones is located inferior, and if you remember, the name of this bone is vomer, and one of these bone is located superior, and this bone is perpendicular plate of ethmoid bone. So your nasal septum is made up of two bones. The inferior part is the vomer, and the superior part is the perpendicular plate of ethmoid bone. Then you can see the concha in your nose. You studied and you learned about this concha in 2050 in the skull part. You know that our ethmoid bone has two concha. One of them is superior nasal concha and the other one is middle nasal concha. And in this sagittal section, you can see the superior and the middle nasal concha. They are the projections from our ethmoid bone. But we have the other concha, which is inferior nasal concha. And this inferior nasal concha is the separate bone, and you can see it on both parts. But why do we have concha inside the nose? Inside the nose, all of these concha can increase the surface area. These concha are lined by the pseudostratified ciliated epithelium. By these cilia, all the particles which we have in the air are swept, and all the particles are trapped in the mucous which we have here. So we need to increase the surface due to the function of our cilia and also the goblet cells. Between the concha, as you see here, you have some veins. These veins are called meatus. Between the superior and middle nasal conchae, we have the superior nasal meatus. Between the middle conchae and the inferior conchae, you can see the middle nasal meatus. And between the inferior conchae here and the heart palate, you have the other way, which we call it inferior nasal meatus. So the meatus are the ways which we have between conchae. We have three conchae and we have three meatus here. The other things which you need to know about your nasal cavity is this. We can divide our nasal cavity into three parts. The first part of our nasal cavity is green here. We call it nasal vestibule. Vestibule means opening, and it's just located inside the nostril. In this part, we have skin. The epithelium is similar to the epithelium of the skin, and you have long, thick hair. And these long, thick hair are called vibrissia. After that, you have this blue region. The blue region is called a respiratory region. And the respiratory region is the region which is lined by pseudostratified ciliated columnar epithelium. In this part, we have extensive vascular network, and this vascular network can make the air become warmer. And also, you can see the cilia and the goblet cells here. And after that, you have this yellow part or orange part here. We call it olfactory region. This is the superior part of our nasal cavity, and it contains olfactory epithelium. In the olfactory epithelium, we have many nerve endings, and these nerve endings can pass through the cribriform plate of, do you remember the cribriform plate of the ethmoid bone? They pass this cribriform foramen and go to the olfactory bulb of our brain, and then we can detect the odor. So our nasal cavity inside is divided to the nasal vestibule, respiratory region, and olfactory region. Also, we have a duct which we call it nasolacrimal duct. I want to show you the nasolacrimal duct. In this picture, no, I don't have the nasolacrimal duct here to show you. The nasolacrimal duct is a duct which we have between our eyes and the nasal cavity, and it can drain the lacrimal secretion from the eye surface to the nasal cavity. And it's interesting to know that when you are crying, you have a runny nose too, because some parts of your tear come out of this nasolacrimal duct and come out of your nose. The nasal cavity warms, cleans, and humidify the air. The air is warmed by the extensive blood vessels which we have here. The mucous trap dust, microbes, and foreign particles. The cilia sweep mucus toward the pharynx to be swallowed, and the moist environment can humidify the air, and we have some air turbulence created by conchae and enhance all of this process, which you can see here, make warmer, cleaner, and make the air more humid. And rhinora is the runny nose, and it occurs as the result of increased production of mucus at the time of allergies and viruses. Virus infection, increased secretion from lacrimal duct draining into the nasal cavity when we cry, and when we expose to the cold air. We have a water condensation in our nose, and our cilia become less effective. They cannot send the mucus back So we have runny nose and the mucus come out of our nasal cavity. After the nose, we have some structures which we call them paranasal sinuses. They are the spaces between the skull bones, and we call them as similar the name of the bone which they are located. And all of them are connected by ducts to our nasal cavity. Look at the picture. In this picture, you can see the sinuses, the paranasal sinuses. The first one is the maxillary sinus, which is located in our maxilla from inferior to superior. After that, you can see the sphenoid sinus, which is located in our sphenoid bone. You can, this is, sorry, the sphenoid sinus. Then you can see the ethmoid sinus in our ethmoid bone, and these are frontal sinus in our frontal bone. There are cavities which we have in our skull bone. They have some functions. First, they make our skull become lighter in its way. The second function is the air pass through these sinuses, so it becomes warmer and more humid. And also the sinuses are important for our voice and the sound which we produce. So when you have sinusitis, your voice change a little bit. The sinuses are aligned by pseudostratified ciliated columnar epithelium, and the mucus which we have here can trap the dust and pollens and everything which we have, and then we can swallow this mucus. And we have sinusitis or sinus infection and sinus headaches. When we have respiratory infection or when we have allergy, the sinuses become inflamed. And when they become inflamed and when we have inflammation there, the fluid remain there, so they become full of fluid. You think that your head become heavy, you cannot hold your head and you like to lay down. And due to this blockage, they can make pressure on your head, and we call it sinus headache. This sinusitis should be treated by a wide spectrum antibiotics, because they are the blind pouch there, and we need time to remove all of these microbes from them. The next part in our respiratory system is called pharynx. The pharynx, commonly called a throat, is a funnel-shaped passageway which the average 13 centimeter or 5.1 inches. As you see here, the pharynx can connect the nasal cavity, oral cavity, and the larynx and trachea together. The function of pharynx and the structure of pharynx is very important. The lateral wall of pharynx is composed of a skeletal muscle, and we can divide the pharynx into 3 different parts. The first part is called nasopharynx. Nasopharynx is the most superior part of the pharynx. As you see here, it's located posterior to our nasal cavity and superior to the soft palate. This is the nasal cavity. Here you can see the palate, and the nasopharynx is located here. It's lined by pseudostratified ciliated columnar epithelium. In this part, we only have the passage of air. We don't have any food here. It connects to middle ear by a tube, which we call it auditory tube or eustachian tube. And in this picture, let me show you, you can see the opening of this tube. This is the opening of auditory tube or eustachian tube. This tube can connect our nasopharynx and our middle ear cavity, and it can equalize the pressure on our tympanic membrane. When you are in the plane and when the plane wants to do takeoff, you can sense that your air block, and this is because of the blockage in this auditory tube. For prevention of this blockage, the crew suggests you to chew something, to chew gum or chocolate, and for the babies, we start to feed them with their milk bottle, or we can use pacifier for them. And the next part of, also in the nasopharynx, you can see a tonsil. This is the pharyngeal tonsil, which we can see in our nasopharynx. We have the other tonsil, which is a tubal tonsil. It's not as important as the pharyngeal tonsil, and you know that when the pharyngeal tonsil become inflamed, we call it adenoid. Then the next part is called oropharynx. The oropharynx is this purple part, and the oropharynx is the middle part of our pharynx. It's posterior to our oral cavity. Here you can see the oral cavity, and this is the oropharynx here. This part is lined by non-keratinized stratified squamous epithelium. Its epithelium is the same epithelium which we have in our mouth cavity. And in this part, we have two tonsils. One of them is called palatine tonsil, and the other one is lingual tonsil. The palatine tonsil are located on lateral wall of oropharynx, and the lingual tonsil is located in the base of our tongue. And the last part, the inferior part of our pharynx, is green here, and we call it laryngo or laryngopharynx. This is the narrow part of our pharynx. It's located posterior to the larynx. This is the larynx, and this is posterior of the larynx. And this is our hyoid bone. So from the level of our hyoid bone, the laryngopharynx starts. This is a passageway for both air and food, and this part is lined by non-keratinized stratified squamous epithelium. The function of pharynx is very important during swallowing. When you want to swallow something, this soft palate and uvula should go up and close your nasopharynx here, so the food cannot go to your nasal cavity. The epiglottis here, which we have in the larynx, close our trachea, so the food cannot go to trachea. And the only way where the food can go is our esophagus here, and it can go easily to our esophagus. So when you talk and eat, when you cry and eat, you see that sometimes you choke because this epiglottis become confused. It doesn't know where to go, where to close. So the food can go to trachea and we have choking. And we have this problem in babies, specifically newborns, when they cry and we try and force to feed them. This uvula cannot go up, and at the time of crying, it cannot close their nasopharynx, so the milk go to their nasal cavity and it comes out. So the function of the structures which we have in our pharynx is very important, and you need to know that your pharynx can make a large amount of immunity for you, because we have palatine tonsil, lingual tonsil, and also pharyngeal tonsil and tubal tonsil in this part. So our pharynx is divided to nasopharynx, oropharynx, and laryngopharynx, and I talked about all of this slide on previous picture. And again, you can see the structure of pharynx here and also auditory tube. This whole structure, this whole funnel tube is your pharynx. You can see nasopharynx first, and this is the pharyngeal tonsil. And you can see the auditory tube or eustachian tube. As you see here, it can connect your nasopharynx to your middle ear, and it can equalize the pressure on your tympanic membrane. In the opening of this auditory tube, you can see a small tonsil, a minor tonsil, which we call it tubal tonsil. Then you can see your oropharynx here, and these are the lingual tonsils. And then we have laryngopharynx. Here we have larynx. This is the trachea, and this is the esophagus. Here you can see the hyoid bone, and the hyoid bone can show you the level of here and the start of your laryngopharynx, which continue to this part. And now you can answer these questions. What are vibrissia? Remember the long, thick black hair which we have in the vestibular portion or part of our nasal cavity, between which concha is the middle nasal meatus located. What is the difference between the lining of the oropharynx and that of the nasopharynx? And in which part of the pharynx are the pharyngeal tonsils located? Now, about the lower respiratory tract. It includes the conducting pathway from larynx to terminal bronchioles and include structures involved in gas exchange, respiratory bronchiole, alveolar duct, and alveoli. So in lower part of our respiratory tract, we have both conducting pathway and a respiratory part of our respiratory system. The first part which I want to talk about is our larynx. The other name of our larynx is voice box. Is a somewhat cylindrical structure that average about 4 centimeters in its length. It's continuous superiorly with the laryngopharynx and inferiorly with our trachea. The superior opening from the laryngopharynx into the larynx is called laryngeal inlet or laryngeal apparatus or laryngeal auditus, which I will show you in the previous picture. Let me look at here. This part is called laryngeal inlet, the opening of our larynx. We have several functions for the larynx. First, it can pass the air when it's open. It can prevent ingested material from entering the respiratory tract by the function of epiglottis, and epiglottis is one of the important cartilage which we have in our larynx. It can cover the superior opening of our trachea during swallowing. The other function is produce sound for speech. We have some ligaments inside the larynx, which we call them vocal cord. They vibrate during expiration and they can make sound. And the other function which we have for our larynx is assisting in the temperature increasing of the abdominal cavity. The epiglottis of the larynx close over the laryngeal inlet so the air cannot go out. At the same time, we can contract our abdominal muscle, make pressure on the diaphragm, and all of this pressure are called Valsalva maneuver. And we can use this pressure at the time of urination, defecation, and childbirth. And the larynx is important for making this pressure by the function of epiglottis. And the larynx can participate in both a sneezing and coughing reflex. Both a sneeze and a cough result in the explosive blast of exhaled air. This occurs when the abdominal muscle contract forcefully and the vocal cords are initially closed and then open abruptly, and the pressure increase in the thoracic cavity. And sneezing is a reflex initiated by the irritant which we have in our nasal cavity, whereas coughing is initiated by irritant which we have in our trachea and bronchi. So you need to know what is the difference between coughing and sneezing, and both can help remove irritant from our respiratory tract. And now I want to talk about the larynx anatomy. Let me show you the anatomy of the larynx on these pictures. First, you can see different cartilages here, which are blue in their color. And you can see the hyoid bone in this part, in the anterior view of our larynx. You need to know that the hyoid bone is the only bone without any connection with the other bone of our body. It cannot make any joint with the other bones. The larynx formed and supported by 9 pieces of cartilage. The cartilage held in place by ligaments and muscles. These are the ligaments and these are muscles, as you see here. We have one thyroid cartilage, which is the largest cartilage of our larynx. One ring-like cartilage, which we call it cricoid cartilage. And on the posterior view, you can see epiglottis. This is a leaf-like cartilage, and we only have one epiglottis. And then we have 3 paired cartilage. One of them is here, we call it arytenoid cartilage. One of them is attached to arytenoid, and we call it corniculate. And the other one is further, and we call it cuneiform cartilage. Arytenoid, corniculate, and cuneiform are paired cartilage. The thyroid cartilage is large and shield-shaped, and the anterior part of thyroid cartilage has one bump or projection. We call it laryngeal prominence, or we call it Adam's apple. We can see it in some individuals' neck, and it's larger in male most of the times than female. It enlarges during puberty. And the other cartilage is ring-like. You can see it in anterior and also the posterior part of your larynx. This is the epiglottis, which is a spoon shape or leaf shape. And then we have these smaller cartilages in the posterior view: arytenoid, cuneiform, and corniculate. All of the cartilages which we have in the larynx are made up of hyaline, except epiglottis. The epiglottis is made up of elastic cartilage, and due to its elasticity, it can easily close the opening of larynx and trachea at the time of swallowing, and then when we want to do inhalation, it goes back to its original location. And this is the oblique view, and in this oblique view it wants to show you the arytenoid, cuneiform, and corniculate cartilage, the ligaments and the muscles which we have in our larynx. The muscles which we have in the larynx are divided into 2 groups. Some of the muscles are called extrinsic muscles, like this muscle. The extrinsic muscles can support the external surface of the larynx and attach this external surface to the neighboring structure. As you see here, the neighboring structure is hyoid bone, for example, here, or the neighboring structure is the trachea, which starts after the larynx. And we have some intrinsic muscles. These are the intrinsic muscles which you can see. They are located inside the larynx, and we have vocal ligament and vestibular ligament. We have some intrinsic muscles in this part, and also we have some intrinsic and extrinsic ligaments. This is the extrinsic membrane or ligament, and inside you can see an intrinsic ligaments. And the intrinsic ligaments are very important for making sound. We can divide them to vocal ligament and a vestibular ligament, which I will show you in the next slide. Okay. Before I talk about this slide, let me show you this part. The ligaments of our larynx are divided to two types of ligament. The internal ligament. One of them is called vocal and the other one is called vestibular ligament. The vocal ligaments are extend between thyroid and arytenoid cartilage. Look at this picture. This is the vocal ligament. As you see in this picture, these two ligaments are located between thyroid cartilage and arytenoid cartilage. They are covered by mucosa and they can make vocal fold for us. These folds are called true vocal folds. Vibration of these folds can make sound. We have the opening, as you see here, we have the slit or opening between these two folds, which we call it rhimaglottis. Look at this picture. This is the rhimaglottis, the opening which we have between these two true vocal cord or true vocal fold. These folds can make sound for us, vibration of them. Here you see that this is the superior view of the larynx. When we want to swallow something, this part is closed. When we want to talk or do inhalation and exhalation, this part becomes open. And also we have two other folds which we call them vestibular fold or vestibular ligament. In this picture, you can see the vestibular ligament on both sides of vocal ligament. They are attached between the thyroid cartilage and arytenoid and corniculate cartilage. They cover with mucous and they can make fold, which we call it vestibular fold, false vocal cord. They play no role in production of sound, and the only function is protection of our vocal cord and opening and closing of these rhimaglottis. And vibration of the larynx can make sound for us. We have an intrinsic laryngeal muscle which narrow the opening of rhimaglottis, and the air is forced past the vocal cords during expiration. And we have three important factors for the voice. One of them is called range, one of them is called pitch, and one of them is called loudness of the range of a voice is determined by the length and thickness of the vocal cord. Males generally have longer and thicker folds than the female, and thus male can produce sounds that are in lower range. Our vocal folds increase in length as we grow. which is why our voice becomes lower or deeper when we are in sexual maturation. The other factor and characteristic of the sound is pitch or frequency of the sound. And the pitch is determined by the amount of tension on the vocal cord, and they are regulated by the intrinsic laryngeal muscles. Increasing the tension on the vocal folds causes the vocal folds to vibrate more when the air wants to pass through them, so they can make higher sound. And the other one is the loudness of the sound. It depends on the force of the air passing across the vocal cords. A lot of air forced through the rhizoglottis can produce a loud sound, whereas a little air produces a soft sound. When you whisper, only the most posterior portion of your rhizoglottis become open, and the vocal folds don't vibrate. Because the vocal folds are not vibrating, the whispered sounds are all in the same pitch. And the sound production is due to passage of the air in resonating chambers. After the sound is produced in our larynx, it should pass through our pharynx, nasal cavity, paranasal sinuses, and our oral cavity. And all of them are the chambers which the sound start to turn and circulate in them, and then the sound can come out. Our lips, teeth, and tongue can help form a speech sound for us. And we have a problem, we have a disease which we call it laryngitis. Laryngitis is the inflammation of the larynx that may extend to its surrounding structures. We have both viral and bacterial infection which can make laryngitis, and laryngitis sometimes follows overuse of voice, such as yelling for several hours, for example, at football game. Symptoms include hoarse voice, sore throat, and sometimes fever. Severe cases can produce inflammation and swelling extend to epiglottis. So we should pay attention to this problem. Specifically in children, it's very important because it can make obstruction of the airways. I will talk about trachea in the next video.